Today we will be talking about schizophrenia, psychobiological disorder. Schizophrenia is a severe chronic mental disorder that affects perception, thoughts, and behavior, often leading to severe impairment and daily functioning. Onset usually occurs in late adolescence to early adulthood, and this is an unknown cause. People are usually first diagnosed with schizophrenia after the first episode of psychosis. But what is psychosis? It causes a person to lose their sense of reality. When experiencing psychosis, people may have false beliefs or experience things that aren't real. Psychosis is not a condition, it is a set of symptoms. So we have the symptoms of schizophrenia. There are three categories, which is positive, negative, and cognitive symptoms. Positive is symptoms that are highly exaggerated ideas, perception, or actions that show the person cannot tell what's real from what isn't. The word positive means presence and rather than the absence of symptoms. They can include a hallucination that might hear, see, smell, or feel things that no one else does. The type of hallucination in schizophrenia includes auditory. The person most often hears voices in their head. Visual, someone might see lights, objects, people, or patterns, often their loved ones or friends who are no longer alive. Tactile, this creates a feeling of things moving on your body, such as hands or insects. Olfactory and gustatory, this can include good and bad smell and taste. Which are false beliefs that seem strange to most people and are easy to prove wrong. If you are thinking that you are a king of the world or entertainer or politician, that's called delusion of grandeur. Next, we have the confused and disorganized speech. People with schizophrenia can have a hard time organizing their thoughts. When they talk, their words can come out jumbled and not make sense. Let's now go to negative symptoms. These are lacking typical behaviors such as bathing, socializing, taking care of basic needs, or showing emotion. Under this is anhedonia, or lack of pleasure. The person may not seem to enjoy anything anymore. Alogia, or trouble with speech. They might not talk much or show any feelings. Apathy. This might include no longer making plans with friends. Avolition. People having trouble or finishing what they started. Social withdrawal, decreased desire to socialize. There's not much motivation to be around other people or interactions. Flat affect or flattering. When they talk, their voice can sound flat, like they have no emotions. They may not smile normally or show useful facial emotions in response to conversation. Next will be cognitive, which affect thinking process, impaired memory, attention deficit, functional impairments. Although the exact cause of schizophrenia is unknown, it still suggests that it is a complex condition, likely caused by a combination of factors rather than a single one. So let me discuss to you the contribution factors of schizophrenia. Genetics. Schizophrenia tends to run in the families. So if one of the member of your family have schizophrenia, it is more likely you're gonna have schizophrenia too. While no single gene is responsible, a combination of multiple genes can increase a person's risk. Brain chemistry and structures. Brain structure abnormalities, which have brain changes, enlarged ventricles, decreased gray matter, cortical atrophy, may contribute to schizophrenia. Environmental factors, prenatal stressors, exposure to infection, malnutrition, or stress, psychological stressors like childhood trauma, which was being abused or neglected, substance abuse, the use of certain mind-altering drugs, particularly marijuana, during the teenage years and young adulthood, is associated with higher risk of developing this condition. Anatomy and physiology of the brain. Brain regions affected in schizophrenia. Prefrontal cortex. So this is your brain's like CAO. It handles decision, planning, and social stuff. In schizophrenia, it's underactive. which is also called hyperfrontality, leading to issues with attention and overall function. Hippocampus, which is very important in memory formation. In schizophrenia, it shows volume reduction in many patients. So it affects learning and recall. Amygdala, it controls emotions and fear responses. So if it doesn't work well, it may lead to paranoia and problem with controlling emotions. Thalamus, the brain sensory relay station. Dysfunction here can cause sensory hallucination and poor information processing. Ventricles. Individuals with schizophrenia have enlarged lateral ventricles, suggesting brain tissue loss or atrophy. Differences in brain chemicals called neurotransmitters. Certain neurotransmitters may be too active or not active enough. Dopamine and glutamate are neurotransmitters linked to schizophrenia. They carry messages that help you think and understand and motivate you. Excessive dopamine activity may cause positive symptoms like hallucinations and delusions. And reduced dopamine activity is linked to negative symptoms like apathy or social withdrawal. Glutamate is a major excitatory neurotransmitter that involved with memory, mood, and thinking, and it activates some part of the brain. NMDA receptor dysfunction within the glutamate system could potentially explain some of the cognitive deficit and negative symptoms observed in individuals with this condition. And serotonin, specifically 5-HT, involved in mood, cognition, and perception. And here's the chart of the summary of the brain changes. Now let me introduce to you our patient named Michael Trenton, 28-year-old male, Filipino-Canadian, lives in Yorkton, Saskatchewan. Rents one-bedroom apartment alone in a subsidized housing unit, diagnosed 5 years ago of schizophrenia. He has a long-term mental health problem that has led to several hospitalizations in the past. Current admission is due to a relapse caused by not taking medication and psychosocial stress. Some of the symptoms were auditory hallucination, paranoia, and not wanting to be around other people. He is now stable on medication and taking part in group therapy. Michael Trenton was diagnosed diabetes mellitus 2 years ago with a mild case of social anxiety disorder and used to smoke but stopped 6 months ago. Michael has limited family support. His parents live in the Philippines and he only sees one cousin in Toronto sometimes. He has a mental health outreach nurse and a caseworker, joined a local group for young adults with mental illness. He goes to church with his cousin once in a while and wanted to join a community garden and a book group at the library. So we have two quotes here for Michael Trenton, used as therapeutic communication. First is active listening and empathy. It sounds like this week has been a little overwhelming for you. Can you tell me more about what's been on your mind lately? So why does it work? This quote shows that using reflective listening and invites the patients to share thoughts without judgment. It helps build trust and encourage open communication. Next quote is normalizing and encouraging expression. Many people in your situation feel nervous about going home. What are some things you're feeling unsure or worried about? So why does it work? This normalizes the patient's experience and gently prompts them to share concerns, which can help understand potential discharge needs or fears. Nursing diagnosis for Michael Trenton: disturbed thought process related to brain changes, such as dopamine imbalance, as evidenced by delusional thinking, suspiciousness or paranoia, disorganized communication, or impaired cognition. Treatment goal: the patient will be able to verbalize that they recognize their changed thoughts and start using coping strategies to deal with them within 3 days. Our nursing intervention is to provide reality-based feedback and calmly refocus conversations when the patient expresses delusional thoughts. For example, I understand that feels very real to you, but I don't see it the same way. Let's talk about what we're having for lunch today. Our evaluation: patient attends 2 group sessions before discharge and reported feeling more comfortable being around with other people. Second nursing diagnosis is social isolation. Second nursing diagnosis is social isolation related to impaired social interaction, fear, and hallucination, as evidenced by withdrawal from social activities. Treatment goal: patient will be participating in at least one structured group activity before discharge and identify one support person that they can reach out to after discharge. Nursing intervention: encourage and help people take part in structured group activities to help them interact with others and feel less alone. For example, go with the patient to their first group session and introduce them to other people in the program. In our evaluation, the patient went 2 group sessions before being discharged and said that being around with other people made them feel comfortable. Treatment outcome: the patient is actively involved in social interaction and has found at least one support person or community resource to connect with after discharge. Doctor's prescription for Michael Trenton is risperidone or Risperdal. Risperidone helps manage positive symptoms, hallucination, delusion, and may also have some effects negative symptoms like social withdrawal, apathy, by blocking dopamine and serotonin receptor in the brain. Purpose of this medication: this medication helps balance chemical in your brain to reduce symptoms like hearing voices or feeling paranoid. How to take it: take at the same time every day, with or without food. Do not stop suddenly without talking to your healthcare provider. If a dose is missed, take it as soon as possible, but skip it as it's close to the next dose. Common side effects: drowsiness or dizziness. Avoid driving until you know how it affects you. Weight gain, increased appetite, muscle stiffness and restlessness. Call your doctor if you feel very stiff, shaky, or have unusual movement you cannot control. And important consideration for Michael, since he has type 2 diabetes, risperidone can raise blood sugar levels, so monitor blood glucose regularly. Maintain a balanced diet and attend follow-up appointments with both mental health and diabetic care teams. When to call for help: if you have high fever, confusion, muscle rigidity, it could be a sign of neuroleptic malignant syndrome. But what is NMS? It is a life-threatening reaction to certain medication, particularly antipsychotic medications. Next, when to call for help is new or worsening suicidal thoughts, sudden changes in mood or behavior. Lifestyle tips: avoid alcohol and drugs, stay hydrated, and try to include physical activity to help manage weight. Keep a medication chart or set alarm as reminders. Community support resources in Saskatchewan. Schizophrenia Society of Saskatchewan Peer Support Group. It offers support for individuals living with schizophrenia or psychosis, including in-person and online support group, access to peer support workers, and educational resources. It will provide Mike with real-world peer connection and support from individuals with life experience. Accessibility Yorkton, Partners in Mental Health and Well-Being Program. It is a drop-in day program for people experiencing mental illness symptoms, offering life skills, employment readiness, volunteer placements, social and recreational activities. Sign Yorkton, Rapid Access Counseling. It is a free confidential counseling service, individual, couple, or family, trauma and strength informed, prioritized for low-income individuals. So here are the community support resources in Saskatchewan for Michael or for anyone else with schizophrenia. Here are the address, phone number, email, and website. Crisis Intervention Resources. Helpline 811 in Saskatchewan is a confidential 24/7 telephone service providing mental health and addiction support. It is helpful for Michael since it is an immediate professional guidance during early signs of crisis like worsening of symptoms, emotional distress, with support available in 100 languages. Next crisis resource is Parkland Crisis Center. a local 24-hour mental health crisis helpline serving Yorkton and surrounding areas. Staff can assess risks, provide emotional support, and coordinate mobile crisis response if needed. Just dial 306-783-4357 in local Yorkton.